Welcome to Effective Cannabis Conversations, the show where knowledge meets curiosity and stigma takes a back seat, where we uncover the transformative potential of cannabis in health. Before we dive in, just a quick reminder, the information we're sharing today is for health awareness only. It is not medical advice or a substitute for consulting your doctor. It is here to help you learn, ask the right questions, and make informed decisions about your health and your care. Welcome back to another Effective Cannabis Conversation. I'm Debi Wimberley, your host, and very excited to welcome Dr. Amanda Reiman and to have this opportunity to chat. Amanda is the founder of Personal Plants and the pioneer of research in medical cannabis, including the use as substitute for alcohol and other substances. Her work helps people develop healthy, balanced relationships with cannabis. Amanda, thank you so much for being here. And can you start us off by telling us a little bit about yourself and all the work that you do?
Sure. Well, it's lovely to be here, Debi. As you mentioned, my name is Dr. Amanda Reiman. I'm coming to you today from Tacoma, Washington, where we have entered the dark time of year. So it pretty much looks like night all the time. So as you mentioned, I'm a cannabis researcher. I first started working in cannabis research in the early 2000s. I grew up in Chicago in the Midwest and then moved out to the Bay Area of California in 2002 to start the PhD program in social welfare at UC Berkeley. And at the time, unbeknownst to me, there was a medical cannabis revolution happening in the Bay Area. You had dispensaries in cities like Oakland, Berkeley, and San Francisco. And even though they didn't have licenses from the state, they had licenses to operate from their city. And coming from Chicago, where we were still very much in prohibition times in the early 2000s, it really astounded me how they were making cannabis available to folks, and not just flower, but manufactured products like tinctures and edibles. And I was a medical cannabis patient myself. I had been using cannabis for arthritis and for some digestive issues. So I became an official patient in 2002 and got my medical cannabis card. And I started going to dispensaries. And one of the things I noticed from a social work perspective was that dispensaries were really operating as community health service providers. And this really goes back to the work from the LGBTQ community around HIV/AIDS in San Francisco in the 1980s and 1990s, that this model of community care emerged for cannabis. And so, as a social worker and a mental health professional, I was very, very interested in this model. It was very different than what we see when we go to CVS or Walgreens to pick up our prescription. There were a lot of other services being offered to patients, like acupuncture and massage and entertainment, like open mic nights and poetry readings. And it was a really interesting model of healthcare. So I decided to study it. The laws around cannabis were changing. It was something that I knew was not going to necessarily be around as a model of care in another decade. So I wanted to capture that moment in time. And it was through that early research that I learned about the use of cannabis as a harm reduction tool, as a substitute for alcohol and prescription drugs. And then as more states started to legalize cannabis, I realized that there really wasn't a voice of reality when it came to cannabis. People were either saying it was good for everything and had no risk, or it was bad and had a ton of risk. And so I really wanted my voice to be somewhere in the middle. I wanted people to know both the risks and benefits of cannabis use. I wanted them to understand how to make cannabis a healthy, balanced part of their lifestyle. And so that's why I founded Personal Plants as an education platform to help people better understand how to best fit cannabis into their life.
Wonderful introduction. Thank you for that. I love that. A couple of questions that came up for me through there is you said you got your medical cannabis card. And could you speak just a few minutes about the role and the importance of patients having a medical cannabis card? Because I've been a medical cannabis patient since 2015. And even though we've gone to recreational, I still carry my card because I believe it's important. Would you mind sharing a little bit about that?
Sure. Well, there used to be a time, and in some states this is still the case, where you can't access cannabis without a medical cannabis card. So when I moved to California, we didn't have adult use legalization yet. And so if I wanted to access cannabis from a dispensary and not from the unregulated market, then I had to get a card. And so one of the things we see is that when states move from medical only to adult use, the number of people with cards declines dramatically. And I think this is to be expected, right? So some people had cards, they now have adult use, they don't need a card anymore. It's almost like your medication going from prescription to over the counter. And so you say, well, I'm not going to go through the process of getting a card anymore. I'm just going to use the adult use market. And we can talk a little bit about the impact that adult use has had on medical access. But for some folks, there's still a very good reason to get a card. For one, there are financial incentives. So here in Washington, we have a very high tax on cannabis, 37%. You do not pay that tax if you are a medical patient. In California, you have higher possession limits. So if you're not a patient, you can only purchase an ounce of flower at a time. If you are a patient, then you can purchase 3 ounces of flower at a time. Some states have higher potency availability for medical patients. So that's another reason why you may get a medical card. And then also, people feel like maybe it offers them a bit more legal protection. So, we still don't see protection for medical cannabis patients when it comes to employment. In some states, you have limited protection when it comes to things like parental rights. But by and large, being a medical cannabis patient doesn't really get you much in terms of legal protection when it comes to the actual law. But there is this belief that if you have a card, you can show that it is medical need and that elevates your use beyond just recreational. So some folks get a card because they feel that it adds an extra layer of legal protection.
And I feel that having a card also helps us identify what medical conditions are actually being improved and help with cannabis. And it gives a notice to my doctors anyway that I am taking this seriously and using it as a medicine, not just as an adult use product.
Yeah, I
Because
would say that that's definitely true, and we can look at data from medical cannabis physicians that recommend to see what conditions people are coming in for. Chronic pain is by and large the most common, which isn't that surprising because it's a very common ailment. I will say that one area that kind of gets thrown off by that is that some states have limited lists of which conditions you can use medical cannabis for. So, for example, if you have a state that doesn't allow the use of medical cannabis for anxiety, there may be a lot of people using cannabis for anxiety in that state. We just don't know because they aren't able to get a card for that condition.
I agree. I use cannabis for lung conditions, and that's something that first and foremost is always taboo if you bring that up with anybody. And secondly, we were not capturing that. And I think it's really important that we expand those lists and start capturing actually what patients or individuals are using cannabis for, because therapeutically it does address a lot of issues that we don't talk about often enough, I don't think.
I agree.
You said you are a mental health professional. Can you just speak a few minutes about how you see the mental health field accepting cannabis?
That's been a tough world. That's a tough room, mental health professionals. And I get it, right? When we talk about physical symptoms like pain or seizure, or even sleep, I think it's easier for people to accept because people that have those conditions don't necessarily have any kind of mental health issues going on. When it comes to mental health, it's tough. And I get why it's tough. There is a connection between cannabis and mental health. It is an intoxicating substance. It does bind to receptors in the brain. And even though there's no risk of fatal overdose from cannabis, it doesn't mean that you can't take too much and have an adverse reaction. And for people that are prone to mental health disturbance, either themselves or a family history, it is possible that cannabis could worsen those symptoms or bring those symptoms on earlier than they would have come on otherwise. But that's not necessarily something we don't see with other SSRIs and mental health medications. Sometimes people have to try 3 or 4 medications for depression before they find the one that actually treats their depression and doesn't result in unwanted side effects. So cannabis is no different, but I think because of the propaganda around cannabis and reefer madness and cannabis makes you crazy and cannabis can turn someone that is just a perfectly well-functioning individual and turn them into somebody that has psychosis, like this imagery, I think makes doctors very shy about recommending cannabis for mental health purposes. Now, I will say one of the things that's really brought that a long way is the use of non-intoxicating cannabinoids. So there used to be such a focus on THC, but now with CBD and CBG and the acid forms of THC and CBD, we have the opportunity to treat people with cannabinoids that may be safer for mental health. But I always like to say cannabis is for anybody, but not for everybody. No medication is for everybody. I'm allergic to penicillin. Penicillin does wonders for so many people, but if I were to take it, I would break out in hives and it would be a bad situation. So the key is cannabis right for you? And if it's not, that's okay. That's why we have a myriad of herbs and medications and other things out there to help treat people.
Thank you for that. And I think it's also important to understand that for the mental health field, they need to understand dosing and what that is, because when people are consuming higher than necessary levels, that can be what's causing some of the effects to happen. And so it's understanding that we can really do microdosing and manage a lot of those symptoms and mitigate a lot of that. So it's just education in general that
I
really needs to
agree.
take place for sure. Um, so I think you talked a little bit about what sparked your curiosity and passion about studying medical cannabis, but do you have anything else that you would like to add to that?
Well, one of the things that I'm fond of telling my fellow researchers and advocates and policy people, the cannabis world is very tough. It is new, it is very stigmatized. We have huge gaps in how states recognize it versus how the federal government recognizes it. However, this is something that's a once in a lifetime opportunity. Cannabis has been around for thousands of years, and its history as a dangerous illegal narcotic is very short compared to its history as an herbal medicine. But we all happen to live in the time when that is changing and when we're starting to see cannabis laws change and stigma around cannabis change and access to cannabis change. So to be able to be involved in that, to be able to push that conversation forward is a very unique opportunity. And I think it's something that I wouldn't want to take for granted. I mean, I believe in cannabis as a therapeutic tool because I've experienced it and I know a lot of other people have experienced it. But I also feel that there's a great responsibility among those of us who are cutting the path to this understanding because we're kind of creating the paths that people behind us will follow. And so I study this in part because I want to be someone that is able to help guide where this goes in the future.
Thank you for that. And I think that one of the things that's also important there is that to study it is to help yourself if you're using it medically, because that's where I began. I wouldn't be where I am now if I hadn't dove in and did the studying, because none of the research that I needed was out there to deal with lung health. And
Right.
so it's really understanding, but digging into the research and understanding it. So I think that's a very important message that we share and that we put out so that we can make sure that people, this is one of the things I say is that we just learned about the ECS like 1988. And what if we just learned about the cardiovascular system in 1988? Where would we be? Because heart disease is one of our number one causes of death today. And we need to step up and realize that we all have an ECS, an endocannabinoid system, and the role that it plays in our health, whether you're a patient or an individual or a medical provider.
Agreed. Completely agreed.
So, looking back at your early research, what surprised you the most about people and how they were using cannabis as a substitute for alcohol and other substances?
Well, I was looking at this question and I really wasn't surprised, to be honest. I am a harm reductionist. I fully believe in people's conscious choices to do things that are going to bring less harm to their lives. And we do this every single day. And whether that's putting on a seatbelt when we get in a car, whether that's stretching before we exercise, whether it's avoiding a food that we know is going to make our stomach upset, that is all harm reduction. So we are very used to, as human beings, trying to minimize things in our lives that are going to cause us harm. So if I'm somebody that is experiencing harm from drinking, for example, I may be looking for ways to mitigate that harm. And for some people, that's not drinking, but that's not for everyone. This idea of drug-free America and abstinence only, like that was never realistic. So the idea that someone's saying, well, maybe instead of drinking tonight, I'll have some cannabis. Or, I've been taking these opiates and I don't like the side effects. I mean, constipation and, drowsiness and concern about dependence. I mean, these are all common things that people who are put on long-term opiate use experience. And so they may say, maybe if I use cannabis this time, instead of taking these two pills, I can just take one pill and that will reduce some of these side effects. So I am not surprised that this is happening. I think other people were surprised that it was happening because I think there's this all or nothing mentality where people are like, assuming that folks are either using none of the drugs or all of the drugs, and that they're not making conscious decisions about which drugs they're going to use and when and in what way in order to get the most out of it to maximize the benefits and minimize the risk. One of the things that I saw that was really interesting when I did my first study, it was 130 patients. And at the time, this was the largest sample of medical cannabis patients in existence. So, just to give you a sense of how little we knew about people that were using medical cannabis back in 2005. And one of the assumptions prior to my research was that, oh, I know who goes into that dispensary. It's all able bodied young men who just want to get high. That was what people thought. And when I did the research, I found out that actually the average age was 40 of the patient, and that a lot of these folks were manual labor workers. So these were individuals that started working very physically intensive jobs around the age of 18. When they got to be 40, they started having aches and pains, as you would after doing that job for a long period of time and being 40. And so they were starting to get back pain. They were starting to get knee pain. They were going to their doctor and saying, hey, I still have 20 years to give to this job. And my back hurts every day and my knees hurt every day. And the doctor was like, well, I can get you on painkillers. And they were like, I don't think I want to start that at 40. I'm afraid where that's going to leave me in 20 years. So they're looking for alternatives. And cannabis was an alternative that they found that they were able to use instead of prescription drugs. And in that first study, 76% of patients said, I am using this instead of a prescription drug. And so I think that that was a really important finding because it challenged this notion that medical cannabis was a ruse, that it was really just something that was invented so that people could get high. And that's really not what we found in the research at all.
And do you think that there's more research going into this and studying it deeper now? Or do you think that was kind of like we studied it a little bit, now we're going to move away from it? Because I still see that we're not moving forward in the medical community in general or in society as a whole, that cannabis is a good tool for managing chronic pain.
So the chronic pain is actually one area where we probably have the most research. And that was really driven by the opiate crisis. So if we didn't have, I don't think there would be as much interest and funding for looking for alternatives. But we do definitely have quite a body of research now on the impact of legalization on opiate use. And whether that's looking at the number of prescriptions that have been supplied for opiates in a legal state, pre and post legalization, looking at the reimbursements that are happening at the insurance level, pre and post legalization, or even doing patient surveys, looking at clinical data. We have a good sense that cannabis is an effective substitute or adjunct for opiates that allow people to use fewer opiates or move off opiates altogether. However, healthcare is a business. So just because the research exists doesn't mean that you're going to get adoption. It doesn't mean that doctors who have been prescribing opiates for decades are suddenly going to come around and start learning all about cannabinoids and cannabinoid receptors. It doesn't mean that pharmaceutical companies have any interest in an alternative for what they are selling. So it is like turning the Titanic around. Like we have the knowledge, we know that this is a successful treatment, but getting that actually adopted into the system, especially when cannabis is a Schedule One drug. I mean, we've seen the approval of Sativex from GW Pharmaceuticals, which is a natural THC spray. It is FDA approved, but not available in the United States because THC is a Schedule One drug. So it's available in other countries. It's available in Canada. Epidiolex, which is the CBD version for seizures, is available in the US. But until the schedule changes at the federal level, and until we see a willingness of the medical community to actually learn and feel comfortable with dosing and with how the mechanisms of action work within the body, we're going to have a whole lot of evidence and not a whole lot of action.
I agree. I am often asked, when do you think legalization will change at the federal level? And I said, I've just stopped thinking about that. I think we just have to stay focused on the patient and the individuals that are using it and actually collecting the data to show the improvements that are made. So I think that's my stand on that, as far as I don't think legalization is happening anytime soon.
I agree. I agree with that. When I was working at Drug Policy Alliance back in 2012, 2013, we would kind of banter around the year 2025 at that point, but I think we're going to have to keep moving the needle down the road because it's really going to take someone in charge who really makes this their issue. And we saw some movement in the previous administration. There were several bills introduced at the federal level to change the way we view cannabis federally. But the reality is there's so much going on right now. There's so many things that are more important to legislators than cannabis that it definitely ends up taking a back seat. And so until it has the opportunity to become front and center again, it's going to be really difficult to see anything happen at the federal level.
And also, it's common, if you don't have a health condition to treat, you'll never experience what it feels like to improve your quality of life and improve those conditions. And so that's what usually moves the needle forward for everybody that gets behind this. So how are we going to get everybody in Washington to feel that and understand that? Because it usually takes them having a family member or themselves to really understand and then want to do this. So that again is why patient stories become so important and why we need to make sure we're gathering as many of those and putting them together in collaboration so that we can show, okay, these are all the improvements that are being made, and then maybe we can move that needle. But that is, again, I think is a long way off.
Yeah.
When you hear the phrase mindful consumption more and more these days, it's not something you hear in traditional medicine. So how do you explain it in a way that makes sense beyond just talking about dosing?
So that's a great question. And the reason we don't see it in traditional medicine is because there's very dose specific. So it's like, Amanda, you are prescribed this much, and this is how much you take every day, and you don't even have to think about it. Just put the pill in your mouth and swallow it. So, I'll tell you, I'm on hormone replacement therapy because I'm a middle-aged lady. And I just do what my doctor says. She's like, take this progesterone pill, put this patch on you for your estrogen, and you don't have to think about it. Just do it every few days and you're good. So I think we've kind of been conditioned in pharmaceutical medicine to not necessarily have mindfulness. We just do it's a very authoritarian system. The doctor's the authority. They're telling you what to take. You take it. If you're having a negative outcome, you tell the doctor and maybe they adjust the dose or try something else. But you don't have a lot of power when it comes to pharmaceutical medicines. And if you decide you don't want to take something, then you're non-compliant and then it's your fault. And we could just have a whole show just on that system.
I would love to.
Yeah. Botanical medicines are different. Botanical medicines interact with our system. The same dose could not be as effective on one day as it is on another day. And when a medicine like cannabis makes you feel good, and we all like to feel good, right? We're all getting that serotonin when we're scrolling on social media, and our whole world is designed to hit those pleasure centers. It's a reinforcer. So one of the things that where mindful consumption is so important in cannabis is that it's very easy to take more than you need. It's very easy to say, oh, I took that and my pain is gone and I feel really good. So I'm going to take more so I feel even better. And so that's not uncommon. And I think it's important that if we want to keep our tolerance down, which is very important when you're a medical cannabis patient, because that tolerance builds up quickly. And all of a sudden, your regular dose isn't doing it anymore, and you need more. And then that isn't doing it anymore, and you need more. If you want to be able to stay at a pretty low dose, you have to be really mindful of how much you're consuming. And you have to take breaks if you can, every now and again to reset that tolerance. And so I define mindful consumption as awareness without judgment. So even if you feel like I smoked this joint and I didn't need it, wasn't having any symptoms, I just did it because it's been a long day and I just wanted to feel good. Like be aware of that because you want to pay attention to how much you're using. You don't want to just block it out, but don't judge yourself for that. Don't say, oh, I'm weak, or, I shouldn't have done that, or, just be aware of it. Because when it comes to making sure you're optimizing your medical cannabis experience, you need to be aware of how much you're consuming. Like that is very important. But if you start judging yourself, you're going to block it out. You're going to be like, oh, I don't remember how many joints I had that day because you're judging yourself for how much you're consuming. So, mindful consumption is really important with cannabis. Your dose can change day to day. What your body needs can change day to day. But bringing judgment into it is going to make it really hard for you to have honest awareness of your consumption patterns.
Thank you for that. And because I was able, if I hadn't kept notes, I wouldn't be where I am now because it's what I figured out what worked for me and what didn't work for me. I've been consuming cannabis since 2015 and have never built a tolerance. I did build a tolerance to opiates. I was up to 240 milligrams a day when I was abandoned during the opiate crisis, and that was proved by the doctors and the pharmacist. And they kept having to increase my dose to keep me from living in a pain of 10, and I still lived in a pain of 10. So that's one place where I do see that cannabis and some pharmaceuticals can look alike if you're doing too much, and you can build a tolerance to them. But if you microdose and do it well, I've taught myself that you can do it for a very long time and not have a problem. So that's,
Absolutely. And I'll just plug, so there's a great app called Tetragram, if
yep.
folks are aware of it, which is an app that lets you log everything you're consuming, what you're using, how much it helped you. So, because I always tell patients that when they're starting out, keep a journal because only you know what helps you. So don't listen to your friend who's like, oh, I tried this edible and it was great for my sleep because that's not you. We all have very individual endocannabinoid systems. And the only way to know what your right regime is to track it. So I think that that's a great practice.
And and everybody can track it any way they want. One of the things I was doing was setting a clock every 15 minutes because I was titrating down off of opioids at one point there. And I didn't realize the effect because that's one of the beauties of cannabis. It just starts to make you feel better and you don't realize when that kicked in. And it's
Right.
really important to understand that because then you kind of know what dosing needs to be and how to look at it, especially if you're doing reduction from opioids or anything else when you're doing trying to get off of them. It's really important to understand. Dosing completely changes once you're off everything,
Yeah,
but in the middle of going through that, you really have to understand that. So that becomes really important.
absolutely.
For someone who's nervous about bringing up cannabis with their doctor, what's your best advice for starting that conversation?
Well, my best advice is don't expect a whole lot. Unless you're going to a cannabis doctor who specializes in cannabinoid medicine, or you're going to a specialist in the worlds of like oncology or pain management, the specialists in those fields tend to have a bit more understanding because they see a lot of patients that are treating very specific conditions where cannabis is beneficial. But if you're talking about a general practitioner, or, I went to my gynecologist last month and her assistant had never heard of CBD. And I was like, you are treating so many perimenopausal and menopausal women who are having a lot of symptoms that could be helped by CBD, and you don't even know about it. So I would say don't have very high expectations. If you have already been using cannabis and it's been helping you and you want to bring that up with your doctor, I would lead with that because they do want you to feel better, right? That is one of their goals. Now, they would probably want you to do it their way. But if you have been helped, you might start that conversation by saying, hey, I just want to tell you about something I've been doing that I've been finding really effective for my knee pain. And I know we've been talking a lot about my knee pain. So I just wanted to tell you, since you're my doctor, right? You got to give that nod to authority, that I've been using a cannabis topical or I've been using a cannabis tincture and it's been really helpful. And I would not expect them to really understand why that works. And I also wouldn't expect them to really come out with a ton of support for it in most cases. Now, one thing that doctors don't like is when you act like you know more than them, because again, authority. So one of the things I suggest to patients is if you can find a couple of research articles that address cannabis for your specific ailment, I would print them out and bring them with you and say, I didn't know how much you know about cannabis therapy for this. So I decided to print out these research articles in case you wanted to learn more about it and just leave them with them. And maybe they'll look at them, maybe they won't. You can lead a horse to water. But I think if you start with, this is really helping me and I wanted to tell you about it. And here's some more information if you want to learn about it. That's a good process. Now, if you are not using cannabis and you want to try cannabis, I would not go to your regular doctor for that first. I would go to a cannabis doctor. Now, there are all kinds of quality of cannabis doctors out there, from folks that really understand cannabinoid medicine and will do full consults with you and really can help you on dosing and product, from people that just want to do telehealth and get as many people through the door as they can. So one good source is the Society for Cannabis Clinicians. They have a database of doctors around the country that are members that are trained in cannabinoid medicine. If you know someone else who uses medical cannabis, you may ask them, who did you see and were they good? But it can be tough, just like a regular doctor, right? But you want to find someone that really understands cannabinoid medicine and isn't just checking a bunch of boxes and moving you through the door, if this is where you want to start. And then once you start with cannabis, then you want to bring it up to your other parts of your medical team.
And I think it's important that we start transitioning, and I don't know how this is going to happen, to making sure that the new doctors that are coming through pharmaceutical schools and medical schools are getting better education on the endocannabinoid system and the cannabinoids that are available. Because I think when they start learning and they start their practices and they join other practices, then other doctors around will be seeing, oh, your patients are doing really well. They're happy, whatever. What are you doing? And then they can educate, because doctors don't have the time. I've been doing this for 15 years now, and you don't have the time to spend that I've spent educating myself and learning everything that I have if you're running a practice. And I'm sure you can speak to that as well, that it's not something, it's not like you just learn a few things and then you're done. It's consistent learning every day. I learn something new every day.
Yeah, I agree with that. And we are starting to see some movement there. So there are some medical schools that are now offering elective courses in the ECS and cannabinoid medicine. And what's unfortunate is that our medical paradigm is so ingrained that this is what it is and this is what it means to be a doctor, that when we approach medical schools about incorporating mandatory training on the ECS, they say, well, fine, but then we got to get rid of something because we only have this many weeks and it's already full. with everything we think they need to learn. So if you're telling me there's a whole new thing that we have to put in there and make them learn, we have to get rid of something that they're already learning. And then we go like this. So a lot of endocannabinoid education and cannabinoid education is happening either as electives at medical school or it's happening through continuing medical education. And so doctors who have to take CMEs, right? So that's part of what they have to do to maintain their licensure, can take CMEs that are around the endocannabinoid system. And I do think that there is a phenomena that we have to pay attention to, which is just called aging out, which basically means that people that are part of an older paradigm, an antiquated paradigm, start to retire. And the people that are coming in behind them have different ideas and values and knowledge that they want to see reflected in their education. So I do think that as we see younger doctors starting to go through medical school, we will see more of an opportunity for them to say, how come this is not included in my education? And that I think is really going to be the driver because medical schools want one thing, money. And you get money by people enrolling in your program. And if you start to see that not having mandatory education on the ECS means people are going elsewhere, guess what? You're going to find where you can put it in to that curriculum. We're just not at that point yet.
And I think it's important to understand that how just leaving the ECS out of our education for doctors is so important. And if we could just get them to accept that part, I would be good. Because I think, understanding my ECS and how to maintain it and manage it is great that I know how, but I also need my doctor to understand that. And to understand that, my system isn't like his or anybody else's. And so you need to be working with me and partnering with me and managing my health. Because that's one of the things that, we're all kind of born into the hands of doctors and just said, turn it over to a doctor and trust them. And that's what I did for years. Even being medically trained, I did that because I was a medical technologist. And when I was abandoned, which I thought never would happen in the medical field, it was like, oh my gosh, now I need to become my own health advocate. And that's something that we need to be teaching people on a general basis is that you're looking for a doctor to partner with. You're not looking for a doctor to just dictate or say, take this. We need to be having partnerships now.
Absolutely. And I think that goes for all medicine, not just cannabis.
Oh, yeah.
Unfortunately, there are a lot of folks that feel very vulnerable to the medical system because they don't have the background or the education or the vocabulary to learn what they need to learn in order to be a partner. So they just kind of feel they have to do what the doctor says. And when folks are on public assistance or other programs that may demand that their treatment go a certain way in order to remain eligible, like people that work with the VA. I mean, you can't be a medical cannabis patient and still get opiates through the VA. You can't recommend medical cannabis if you're a VA doctor. Yet we have really fantastic evidence of the use of cannabis as a treatment for PTSD.
Absolutely.
So again, we go back to that. That's that federal state, influence there.
What's one of the biggest myths you still hear about cannabis and health, and why does it get under your skin?
So, this really goes back to why I started Personal Plants. In the advocacy days, you had two polarized sides. You had the prohibitionists who said cannabis is highly addictive and it's a gateway drug and it's going to make you crazy and it's going to lead you to heroin and all of these things. And then you had the activists, with which I was one, who said, no, cannabis has no risk. It's very, very safe. You can use it for anything. It should be available for everyone. It doesn't cause any negative things to happen. And I get why those sides existed, because as the advocates, if we were to say, well, there are these risks, you probably shouldn't use it if you have a history of mental health issues. The prohibitionists would say, see, cannabis is dangerous and you all just won't admit it. And that's why it should stay illegal. So we were kind of forced into these very opposite-ended perspectives. And once cannabis became legal, and now people were like, okay, great, cannabis, love it, want to try it, think it will help my ailments. but I don't really know how to do that safely. You've got one side saying there is no safe way. You've got another side saying all the ways are safe. What's in the middle? And that polarized rhetoric still really bothers me. It bothers me when activists go on social media and say cannabis cures cancer. And that bothers me because, yes, we have research at the preclinical level, meaning cells in petri dishes, that shows that cannabinoids can cause apoptosis, which is basically the death of cancer cells. We have case studies of people who say that they used cannabis and their cancer went into remission. None of those are causational studies, they're all correlational studies. And we know that cannabis does help the side effects of chemotherapy, nausea, joint pain, depression, things like that. But when somebody has cancer, they want hope more than anything. And I feel that it is irresponsible to make those kinds of claims when we still just don't know. We really don't know. We have an idea that there's promise. We want to look into this more. We think it can be very valuable in a lot of ways. But I don't like hearing that any more than I like hearing cannabis will make you crazy. Because I think that they are hyperbole. And if we want people to really make the most out of this plant and get as many benefits out of this plant as possible, we have to give them realistic information. We have to explain to them that smoking cannabis, no, it probably won't cause lung cancer because you're not smoking enough cannabis in order to do that kind of damage to the lungs. Now, can long-term cannabis smoking cause emphysema and COPD and issues with the gums and issues with throat irritation and chronic cough? Yes, it can. And we should let people know that there are alternatives. Maybe don't smoke every time, talking about harm reduction. Maybe sometimes you smoke and sometimes you vape and sometimes you use an edible. Change up that method of consumption. You cannot fatally overdose on cannabis because there are no cannabinoid receptors in the brain in the section that is responsible for regulating respiration. This is why you can fatally overdose on alcohol and opiates because those drugs do reach those receptors. But that doesn't mean there's no cannabis overdose because there absolutely is. An overdose just means you took more than you wanted to or intended to, and now you're having a negative outcome. So I want us to be more pragmatic in our language. And when we start saying there's no such thing as this or this always happens, I immediately discount it. Because being a researcher, I know that there are very few things in this life that either never or always happen. And so I think it's really important that we get rid of that rhetoric and we start giving people realistic suggestions and methods for bringing cannabis into their lives.
And I find that if you've developed serious health conditions, whatever they may be, we don't cure them anywhere. We maintain them, we manage them. So, I specialized in oncology. And, we have a threshold where we say if you're cancer free for 5 years, you're done, you're cancer free. We don't ever say it won't come back. It's like we just always, say you're cancer free after 5 years. And often we will see people that will return to cancer year six. I'm not saying everybody does, but that can happen. So, it's really important to say that anytime you're using, whether it be a pharmaceutical or cannabis therapeutically, we're not curing anything. We're maintaining, managing, and hopefully improving your quality of life. And that should be the goal of whichever one you're choosing to do.
Oh, absolutely. And I was recently at the conference for the Society of Cannabis Clinicians, and that was brought up. This idea of medicine should focus on health and not illness. So medicine should help you feel as good as you can possibly feel. And let's focus on what that quality of life looks like for you. And is it getting better? And are you maintaining it? Instead of focusing so much on the disease state. Because as you said, that state is going to maintain itself. It's just a matter of how it's expressing itself at the moment. So yeah, I totally agree with that.
So let's switch and talk about something that I think you're fairly new into and that you're enjoying a lot, and that's that you've partnered with functional cannabis. And could you just walk us through for a few minutes what you went through in your decision to back this product and what excites you the most about it? Because this is one of the things that I run into often is that, I've figured out what works for me. And so then there's all these new products. And it's like, well, I don't really want to switch to a new product because I know what works. So, as a doctor and somebody that's working in this, what is it that gave you and led you down that track?
So I think that there are several different kinds of cannabis use. There's medical cannabis, and that is I have a symptom I am trying to address with cannabis. And I agree with you. Once you find something that works for you, stick with it. Block out every other thing that comes on the market. And unless it's something that looks just like what you're taking, but is a new and improved version for some reason, and maybe you want to try it. But once you know what works for you, I am a fan of sticking with what works for you until it doesn't. And then looking for why isn't it working anymore and how can I improve it? I also think that there's strict recreational use, which is, I'm about to watch a movie and I want to get a little high first. I'm going to a museum, and that's great. Good. I'm totally in favor of that. I think in the middle, we have therapeutic use, which isn't necessarily medical, but it's also not necessarily recreational. It lives kind of in that wellness space, which is a very amorphous space anyway. And so I'm very interested in this middle space because I think that not very few people actually of all the cannabis consumers are strict medical users, meaning that they have a condition for which they are using cannabis. And some people are pure recreational users, but I think most people are in this middle bucket, meaning that they're looking for help with sleep. They don't have insomnia, but sometimes they have sleep disturbance, like because they're a middle-aged person. Or they're looking for something to help them focus, or they're looking for something to help them recover after a workout, or they're looking for something that's going to help them relax after a hard day and they don't want to drink alcohol. Like, I think that this is all therapeutic consumption. And as I mentioned before, cannabis has a history as an herbal medicine that's way longer than its history as a dangerous drug. And we have a lot of herbal medicines that have been around for thousands of years that have addressed things like sleep and focus and energy and relaxation. But cannabis has been kept separate from them. So when you go to a dispensary, it's like cannabis. Here's your cannabis. And then you go to a health food store or a supplement store, and it's like, okay, here's your ashwagandha and your lion's mane and your valerian root and your passion flower, but no cannabis over here. And I believe that we need to bring these worlds together. That, cannabis helps with sleep, but there are other things that help with sleep in addition to cannabis. And so why can't we have a product that utilizes the benefits of cannabinoids along with the benefits of terpenes, along with the benefits of mushrooms and flowers and herbs and other things that help promote these same effects? So that's what was very interesting to me about this product, is that it is the wellness consumer and it is cannabis and. So, you need to sleep, it's cannabis and valerian and passion flower, right? You're looking for focus, it's cannabis and lion's mane. You're looking for relaxation, it's cannabis and ashwagandha. So I think that this is important. We talked about cutting that path to what this is going to look like in the future. If we want to see cannabis kind of returned back to the botanical medicine world, we need to start letting them play together. And so for people that are looking for alternatives to Advil, or people who are looking for alternatives to an over-the-counter sleep medication, or people who are looking for alternatives to caffeine, this provides an alternative that's very low dose in the cannabinoids because it also incorporates other beneficial herbs and mushrooms.
I love that because Rut Sutson, I'm pretty sure you're probably familiar with who he is, and he's written I call it the Bible on terpenes and flavonoids. And he also talks about this and how we can receive those terpenes and definitely flavonoids from other plants better than we can cannabis. And that's one of the places where I find that we're not focusing enough and understanding that there needs to be a partnership between some of these plants. It's not just one standalone. Whoever created these plants, you can have whatever belief you have, but somebody put them here for a reason. They feel that they're important to us, just like they put apples and oranges here. These are important to us in our body, and we need to be learning how to utilize them to our best. And there's nothing wrong with using alternative therapies when it comes to taking care of your health. So, what
Absolutely.
else would you like to share about your partnership with functional cannabis and your products?
Well, they're gummies. I think that's primarily the form folks will use. They also have some pre-rolls that you can order to smoke, but I'll just say personally, I don't smoke. I did for a long time, and I started to notice negative impacts to my health, my skin, my teeth, my voice. I do a lot of speaking, and I was like, "Arr," kind of graspy there. So I consume tinctures and edibles in a variety of cannabinoids. So I think that they're actually really good starter cannabis products. So for folks that have been curious about cannabis, right, but they don't know where to start, and there's so many products, as you mentioned, on the market, and especially with the hemp market. I mean, they can all be delivered to your house and they're all promising all these things. I find that this is a very well made, well tested product. Like I said, it's very low dose. So it comes in a package of 2 gummies. The focus is only 2.5 milligrams of THC per gummy. The other ones are 5 milligrams of THC per gummy. I eat half a gummy or 1 gummy, and I'm like good to go. But it also takes a lot of the guesswork out of it because they're effects based. So instead of looking at a gummy and saying, well, how's this going to make me feel? Is it going to knock me out and make me tired? Is it going to make me super hyper and I'm trying to go to sleep? Because it has these other herbs in it, you can choose something that's specifically for sleep or that's specifically for energy that also has green tea and yerba mate in it. So I think for folks that want to take the guesswork out of it, and know how they're going to feel and be able to choose the right product for the right exercise or activity. They want something that's low dose because they don't want to get super high. They're not just looking to like get knocked out. And they want something that's really well made. I think, and not just full of chemicals, which you see in some of these other products. I think it's a great place to start for folks. There's going to be very little chance of overdose if you just take one or start with a half of one of the 5 milligram gummies, which is 2.5 milligrams, I think is a great place to start. So yeah, I think it's a really high quality product. And because you have all of those other amazing herbs and mushrooms in there, you don't need as many of the cannabinoids.
And where is this available at?
It's available online. So the cannabinoids are derived from the hemp plant. So it is a federally legal product. They can ship to you unless you're in a state that doesn't allow for those products to come into the state. So you can go online and you can order and try it out.
Is there anything I didn't ask you today that you wish I'd ask or that I left out?
Well, no, this has been such a fantastic conversation. I have so much enjoyed talking with you, and I really appreciate you bringing this knowledge and education to people out there. The last thing I would leave you with is that, the holidays are coming up. I'm not sure how long this goes before it gets put up, but right now we're in the beginning of November. So I'm guessing that maybe before the holidays, this will go out. Holidays are a great time to have the talk. And we used to say having the talk with your kids about not using drugs, but I'm going to say this is a great time to have the talk with your parents about trying cannabis. The fastest growing population of consumers are older adults. Legalization did a lot to help that. Folks didn't want to break the law. They didn't trust what they were getting. They wanted to go to a regulated store where everything was tested and labeled properly. And as I used to tell my students who are all, 21, 22 years old, cannabis is going to be most helpful to you when you are old. Because as we age, we have stuff that happens to us. Our hormones get out of whack. We have trouble sleeping. We have more aches and pains. We have mental health disturbances that happen. So, really, when it comes down to it, the older you get, the more likely you are to be put on pharmaceutical medications or starting to take over the counter medications consistently. So, this is really the time to start looking at cannabis as a treatment. My parents are in their 70s. They live in Chicago. They use cannabis for relaxation. They use cannabis for pain management. And I think it's a really great tool, and you don't have to smoke it. There's a lot of ways to consume cannabis that is not smoking. So if you're getting together with your family, especially if you have loved ones that live in legal states, which there's a lot of them now, just throw that out there when you're recovering from your meal. Hey, has anyone here used cannabis or to have questions about cannabis? And I think it's just a great opportunity to help someone you love discover cannabis and maybe prevent them from using a pharmaceutical or over-the-counter medication that may cause them more harm in the long term.
Thanks for reminding me of that, because one of the things I like to say is I want to see cannabis be a conversation at every dinner table. I think that we
100%.
should all be having these conversations and understanding it because, like you said earlier, everybody wants to feel good. Who doesn't want to feel good? And cannabis does have the ability for a lot of people to make that happen. So let's
Absolutely.
honor that, celebrate that, and let's hope that we are encouraging people to have that conversation over the holidays. Thank you so much for coming and sharing all your information. And I'd like to have you back and talk about other topics because I think you have a wealth of information that people need to know about.
Well, I'd love to come back. We could do a whole show on cannabis and women's health, which I think is super important. So yeah, I'd love it.
We so appreciate you dropping in. Your time and support are invaluable as we strive to educate and advocate for the transformative potential of medical cannabis. Remember, you have only one health and one life, and no one lives them but you. Let's continue this journey together. Subscribe and hit the bell icon to stay updated on our latest conversations. Your comments and engagement fuel the dialogue we need to create change. Until next time, stay empowered and keep exploring the wonders of your endocannabinoid system.